section my president, Miss Margie McLean. Would you like to say anything, Miss Madam President?
First of all, thank you. Thank you for coming. Thank you to Ms. Dr. Chang and Ms. Katey for coming and joining us. Also, we have the president of the derm section, Ms. Sandra Crops, for coming as well. I really would love to thank our organizers, Ms. Jovan Turner and Christina Austin, for putting this together this week. It's been a really awesome week so far. I'm looking forward to learning more tonight about the kidney. And so I'm not going to stay on long, but thank you so much again for joining us.
Okay, so I guess we can go ahead and start. So first, I'd like to introduce Ms. Katey Cipriani. She is from the National Kidney Foundation, where is a community director, and we're going to go ahead and start. We also have Dr. Emily Chang, who is a nephrologist, if I'm not mistaken, that will also answer a lot of questions and be a presenter as well. So if you have any questions, you could definitely put them in the chat. But if there is something within the slides that that touches you, of course, you can let us know, and we'll be more than happy to stop and have the presenters answer your questions. So without further ado, Ms. Cipriani, you can take the floor.
Thanks. Thank you so much for having us out today. Can everybody see my slides?
Yes.
Okay, perfect. So as Christina mentioned, my name is Katey Cipriani. I'm the Community Outreach Director for the National Kidney Foundation serving North Carolina. I am located in Raleigh, but I cover the entire state. And as Christina mentioned, we also have Dr. Emily Chang on with us tonight. And Emily is one of our fantastic volunteers. She's also a member of our medical advisory board here locally. And she is just such a fantastic person. So I'm so excited she was able to join us today. Today you're going to hear our Your Kidneys and You presentation. So it lasts about 45 minutes or so. As Christina mentioned, please feel free to drop any questions you have in the chat, and we'll make sure that we get those answered for you. Okay, so just very quickly about the National Kidney Foundation. We are one organization that has field offices all throughout the state, and we offer a variety of different programs and services to our patients, family members, and the community. This program being one of them. And we'll talk a little bit more about each of those programs just a little bit later. So before we get started, I'm going to start with a few did you know facts. Did you know that 1 in 3 adults, or 33% of Americans, are at risk for kidney disease? 1 in 7 adults has kidney disease, but about 90% of people don't know that they have kidney disease. Kidney disease is the 9th leading cause of death in the United States, but it's also the 9th leading cause of death here in North Carolina. Kidney disease causes more deaths than breast cancer or prostate cancer. So again, it's extremely important to know whether or not you have kidney disease. Early detection and treatment can slow or stop kidney disease progression. And in addition to safety precautions, a healthy lifestyle is important to reduce the COVID-19 impact on your kidney health. So today we're going to be going over what the kidneys do and why they're important. We're going to learn more about kidney disease and dialysis and transplant. We'll learn more about who is at risk and how you can protect your kidneys. And you'll also hear why you should care and what you can do about this important problem. So with that, I'm going to hand it over to Dr. Chang.
Hi, I'm Dr. Chang, and I am going to tell you some about the kidneys, and we'll kind of talk through each of these slides. So if you, like we had mentioned, if you have questions, please just stop me. But when I ask my patients, what do you think your kidneys do? Most people tell me the right answer, or a lot of people tell me the right answer, which is clean your blood. And that is true. And that's kind of the thing at the top, removes waste products. So kind of cleans and filters your blood, and it turns it into urine. But as you can see on here, there's so many other things that the kidneys do. And if we go to the right, in addition to removing waste products, the kidneys also balance your minerals, pH, and your fluid levels. So different kinds of minerals in your body, chemicals in your body, all need to be regulated in order for your cells to do what they need to do. And kidneys help do that, get rid of what they need to, and keep what you don't need to get rid of. They also help balance the fluid levels in your body, which is really important too. So that to make sure that you don't have too much fluid or too little fluid. Moving on to the next one, the kidneys help keep your bones healthy, and they activate, one of the ways they do that is by activating a vitamin D so that your bones can do the repair and building they need. And I know it always sounds a little weird, like kidneys, they have something to do with bones, but they really do, because they're part of this vitamin D cycle, also calcium and phosphorus, and they help regulate all of that to help keep your bones healthy. Moving on, kidneys also help control blood pressure. One of the ways they do it is by making a hormone that helps to keep your blood pressure under control. And there are actually other ways that kidneys do that too. And one of the ways is the fluid that we talked about earlier, but they also regulate this hormone. And then lastly, they help to make red blood cells, another hormone that they make that tells your bone marrow to make red blood cells. And when your kidneys are not working right, sometimes you have low blood cell levels because you can't make the blood cells that you need to. All right, so this is my favorite, but also very complicated slide here that kind of shows you in general how kidneys work. So, whoopsie, hold on, I lost the video. That was me, Katie, not you. I just lost video. All right, so starting at number 1, from the artery, the blood flows down and it flows to the kidneys. You have 2 kidneys, so it can go to the left or the right kidney. And when it goes down, it breaks into smaller and smaller arteries, and it goes to these tiny filtering units called glomeruli. And one is enlarged there for you on the side to show you what it looks like. And these tiny glomeruli, you have millions. They can tell the difference between what you need and what you don't need. So they act like a filter to filter out waste and excess fluid from the blood and allow you to make urine. Then from the glomeruli, the urine then goes out into these tubes that are called the ureters, and they carry the tubes they carry the urine to the bladder. And from there, the urine is removed. And when you urinate, you pass water or go to the bathroom. And that happens from both sides of the kidney. So you have 2 tubes going to the bladder from both sides. Then lastly, the cleaned and filtered blood goes back into your vein and returns that blood, the cleaned and filtered blood with all the right nutrients in it, and goes back to your heart and back into circulation. Oops. Okay. All right. So, so what happens when the kidneys are damaged and they can't work as they should? So there are a lot of problems then that happen. And one is that waste products begin to build up in the body. And then you can start to feel really poorly, and a lot of different symptoms that we often ask our patients about. And some of those symptoms include feeling very tired. You might feel nauseous, you might vomit, you might feel an itching. Sometimes people will talk about a metallic taste in their mouth, and that can happen when you have waste products building up in your body. You can also lose your appetite, which is a problem too, because then you can't get the nutrients that you need. Next, when you have your kidneys not working well, you can also get heart and blood vessel problems that develop. And that's because part of that has to do with the waste products that the kidneys have to clean out, and they can't do what they have to clean out, and they build up in your circulation, and they build up on your blood vessels all around your body and including in your heart. And that can lead to heart disease and any kind of vessel disease really throughout your body, including strokes. And then you can also develop bone disease because, like we said, the kidneys affect your bone health. And you can also develop anemia. And anemia is when you have low blood cell count because, like we talked about before, the kidneys make a hormone that help you produce red blood cells. So if you can't make that hormone, you can't produce the red blood cells and you might get anemic. If you're anemic or have low blood cells, you can feel symptoms like feeling cold, tired, short of breath. Sometimes people have this thing where they feel like they always want to eat ice. And so they want to chew on ice, and that can be from anemia too. So eventually, you know, all of these problems can develop when you have chronic kidney disease, but eventually this can lead to kidney failure. And without treatment, kidney failure will lead to death. So the next good question is, you might be asking yourself, well, I learn all about this about kidney disease. Well, am I in that 33% that Katey mentioned at the beginning? Am I at risk for developing kidney disease? And there are several questions you can ask yourself that will help you figure out, are you in that group? And the first question is, do you have diabetes? And the reason for that is because diabetes is the #1 cause of kidney failure in the United States. And even if you just have what's called pre-diabetes, or sometimes people will call it borderline diabetes, or diabetes that you can control with just diet, even those put you at risk of kidney disease. The next important question is, do you have high blood pressure? And that is important to ask because the second most common cause of kidney disease is high blood pressure. And it counts of having high blood pressure if you take medicine to control your blood pressure and it's controlled. That still counts as having high blood pressure. The next important question to ask is, are you over age 60? And that matters because as you age, just like with all the other parts of your body, as you age, they just don't seem to work as well as they used to. I'm definitely noticing that. Can't get around as well as I used to. My joints hurt. My skin doesn't look as good. So many things going on. Well, the same thing is happening in your kidneys, even if you can't see it. And we like to tell our patients, this is a rough estimate, but usually around the age of 30, that's when your kidneys start to deteriorate. Maybe get a little bit worse every year at age 30. Now that's, if you don't have any of these other risk factors, that may never present a problem to you, but the older you get, the more at risk you are because you're already losing some kidney function. The next good question is, do you have heart disease or heart failure? And those things can also complicate and put you at risk of kidney disease. The heart and the kidney work in very close concert with each other to keep the blood flowing throughout all parts of your body, to keep the blood cleaned, keep good blood flowing to your heart. So it's really important for those two organs to work together. So if you have heart disease or heart failure, then you may have problems getting the blood flow to the kidney that you need, and that can lead to kidney disease. The next question is whether you have a family member with kidney disease. Usually we're talking close family members, a parent, grandparent, sibling, a child that's been on dialysis or gotten a kidney transplant. And that's because there are things that can be inherited, and there are certain genes, we don't know all of them, but we know some that put you at greater risk of kidney disease. And if you have a family member, if you have multiple family members that had kidney disease, even if they didn't need dialysis or a transplant, that also puts you at risk. And then lastly, are you overweight or obese? And that also puts you at risk. And kind of the way I like to think about that is if you're overweight or obese, that's a lot more body where blood flow has to get to. And that blood, all that blood flowing to all the body has to be cleaned by the kidneys constantly throughout the day. And if you're overweight or obese, that's more blood flow, that's more work that the kidney has to do every day. And if you think of the kidney as having a limited life, a limited amount of work it can do, you're kind of running it out faster. You're running through what the kidneys can do on their can do faster. So those are kind of 6 questions that you can ask yourself that help you clue you into, without even needing a doctor, clue you into thinking, am I at risk of kidney disease? And there is a website listed here, minuteforyourkidneys.com, and you can take a quiz there and get your personalized results. And it'll kind of guide you to help talk to your doctor, because this is something, if you think you may be at risk, it's something important to talk to your doctor about. So as I mentioned before, I guess I got ahead of myself. There are 2 leading causes of kidney failure in the United States. And they're listed here again for you: diabetes and high blood pressure. There are more than 100 million Americans that have diabetes, and it is the leading cause of kidney disease. 1 in 3 adults with diabetes may have kidney disease. And in some reports, it's actually even more than that. And I think on average, it's probably about closer to 40%. And that's here on the right, actually 38%. Yeah, it's closer to 40% of patients with diabetes may end up having kidney disease. For high blood pressure, 1 in 5 adults with high blood pressure may have kidney disease, and is the 2nd leading cause of kidney failure in the United States. And I can't tell you how many of my patients have both. And I think of it as the 1-2 punch of diabetes and high blood pressure, and that puts you at big risk. So then if you ask yourself those 6 questions and you're worried that you might be at risk of kidney disease, the next good question is, well, what can I do about it? And again, going back to one of the statistics that Katey gave earlier, 90% of people with kidney disease don't know they have it. And that's just a staggering number. I mean, that's almost all of people with kidney disease who are walking around thinking they don't have kidney disease. And the reason for that is because there just aren't many symptoms of chronic kidney disease. So you can be walking around with kidney disease and not even know it. And that's why we really encourage anyone who may be at risk to get screened, because that's our best way to detect if you have kidney disease, because you just might not know if you have it. And then if you're at risk, then to get tested. And the way to get tested is here on the right. There's 2 main tests we like to do: a urine test, and the urine test checks for albumin, and albumin is a type of protein. So it checks an albumin to creatinine ratio. It's a simple urine test. All you have to do is give urine to check for it, and it is used to assess for chronic kidney disease. The other test is a blood test, and it's a little harder because you have to give blood, but doesn't take much. And what we're assessing for in the blood test is your glomerular filtration rate. And if you recall back to how the kidneys work, the glomeruli were those tiny filtering units that you have so many of in your kidneys. And so what that blood test is testing is how well those little filtering units are working to clean the blood, and that measures your kidney function. And I think there's a couple of questions here, so I'm going to move to them and see if I can answer.
Dr. Chang, one of the questions is, are there specific bad foods that lead to kidney disease? And the other question is there a way to reverse kidney disease?
Yes, very, very good questions. There, as far as diet, I would say, because the two most common causes of kidney disease are diabetes and high blood pressure, specifically for diabetics and patients with high blood pressure, high sugar and high salt diets are not good for kidney disease. It doesn't mean everyone who has a sweet tooth is going to get kidney disease. So it's not necessarily that those foods are bad, but if you have kidney disease, if you have diabetes, if you have high blood pressure, then those things may be bad. As far as diet, there's definitely specific things that we get into once you are diagnosed with kidney disease that may be bad for you. It's not directly to that question, but I do want to answer kind of a side question, is that are there certain medicines that can lead to kidney disease? And I think we talk about this later too, but there are certain common medicines that people use that if you take too much of them can lead to kidney disease. And probably the one I see most commonly is medicines like ibuprofen, Aleve, Advil, and Motrin. And for people who have bad arthritis, they tend to rely on them. And so I will see that sometimes, someone who's been taking that for years, that can lead to some kidney disease. For the next question, is there a way to reverse kidney disease? Not yet, but there is a lot of hard work on, so we do have ways now of slowing down kidney disease, not foolproof, but pretty good. And in the last 5 years or so, much better than what we used to have. We used to have really one group of medicines. Now we have several and several more in the works that can kind of put the brakes on your kidneys getting worse. As far as reversing, we haven't figured that out yet. And the reason is the kidney is a very complex organ, like we showed in that picture. There's just so many parts. And once things become scarred, similar to when you get a scar on your, you get a cut or you have a surgery and you have a scar, it sort of changes that skin forever. You can't make it back the way it was. And that's skin. Skin is a lot simpler than the kidneys. So if we're trying to repair scarred kidney, we don't have a way yet to make that tissue turn into the way it used to be so that it can function. Now there is work being done. This is like almost sci-fi, not sci-fi because it's really being done, but it feels like sci-fi if you're not thinking about it. But work in terms of trying to take people's different things. But for an example, take your regular kidney cells and put it on like a scaffold and let those good kidney cells regrow and grow into a good functioning kidney. There's work being done into building artificial kidneys. So if your kidneys fail, you can get an artificial one. So there's lots of different kind of really high level technology being done out there to try and do what you're saying, either reverse or replace the kidneys that you have so that you don't end up with kidney failure. Long-winded answer. So, but not to make you super sad. The good news is that kidney disease can be treated. So kidney disease is not something that happens overnight. It usually is a slow progression over many years. And this happens, that's why we like to stage it, because it happens in these stages. And we give it 5 stages. And in each stage, the kidneys kind of get a little bit worse. But the good news is, if you get detected, if you know you have kidney disease, with treatment, you can help to put the brakes on kidney disease and potentially even stop it. And the key is to stop it as long as you're alive, as long as you live. So that you don't end up needing a transplant or kidney failure. So you don't need the kidneys to be perfect. You just need them to be good enough as long as you're alive. So your GFR number tells you how much kidney function you have. That's the second test. The first test was the urine for the albumin creatinine ratio. And the second one was that glomerular filtration rate, which we say GFR for short. And your GFR number tells you how much function you have. And as your kidney function gets worse, your GFR, or how much function you have, goes down. So in stage 1, you have some kidney damage, but your kidneys function normally. So they're able to do everything that they need to do. And they function so normally that this is really hard to detect on our kidney tests. That blood test is not good enough to detect stage 1. You really need this 24-hour urine collection to detect it. And so we don't usually have stage 1 detected. Stage 2 is kidney damage, and you have a little bit of loss of kidney function. And so you're down to about 60 to 89%. So not quite at that stage 1 level. So we can detect this sometimes. Stage 3A is the next step, and it's mild to moderate loss of kidney function. And there you're down to 45 to 59% function. Stage 3B is moderate to severe, and you're now at 30 to 44% function. But at stage 3B, you're still not feeling symptoms. So patients come to me like, I don't know why I'm here, but they have stage 3B kidney disease. They didn't feel bad at all. None of those symptoms I mentioned before, but they have 3B kidney disease. And the next is stage 4, which is a severe loss of kidney function. You're now down to 15 to 29%. Even at this stage, you don't feel symptoms. You may, you definitely will have other lab abnormalities aside from your GFR. It'll start to impact other things. And things might be impacted that you're not realizing because you don't have symptoms. And then stage 5 is kidney failure, or less than 15% on your GFR. And usually at stage 5, we've been talking to you about what you want to do if your kidneys were to get worse. So then what could happen if kidney disease is not treated? So if your kidney disease is not treated, or even if it's treated and continues to get worse, kidney failure is kind of the end stage. So you've gone past stage 1, 2, 3A, 3B, 4, 5. The next stage is end stage. So when you hear end stage kidney disease, that's basically your kidneys have failed. And at this point, they're too damaged. They can't function properly. They can't do all those things we talked about at the beginning that the kidneys do. And the problem is that they can't keep you alive anymore, because at this point, 85 to 90% of your kidney function is gone. And in order to stay alive, to not feel sick, those people need another treatment, either dialysis or transplant, until we can get these artificial kidneys. They'll need something like that to live. And I have another question here. Can smoking and drinking contribute to kidney disease? Yes, they can. Both can. Smoking definitely is a risk factor. Drinking can contribute in different ways. It can lead to low blood pressures. Low blood pressure can mean you're not getting good enough blood flow to your kidney, and that can cause problems. Drinking in excess can also lead to liver disease. Liver disease can end up causing problems in your kidneys. Yeah, so that's the answer to your question. Yes, they can. So what are your options if you're get down to that stage 5 and you're approaching end stage kidney disease or kidney failure? Here are your main categories for options. The first here is hemodialysis. And in hemodialysis, hemo is for blood and dialysis. In this case, a machine outside your body cleans the blood slowly over several hours. And you can do this kind of dialysis in a clinic or at home. And I think a lot of people are surprised to know they can do hemodialysis at home, but it's definitely something that's picked up a lot in the past years. And for certain patients, it's a very good option. The next is kidney transplant. In this case, it requires a major surgery, and it moves a healthy kidney from a donor, which can be a living or a deceased donor, surgically, and it's placed inside your body. And the next is peritoneal dialysis. And this kind, peritoneum is the name of a lining in your belly, and it's like sort of like acts like a natural filter, and that cleans the blood. And what you do then is put the fluid into your belly, and things go in and out through that filter, and then you empty it out of your belly. And that's done at home several times a day or overnight. There's a question here. What is the current time frame for someone on the transplant list? So that is going to vary, but I used to say 5 to 7 years, although now for some patients it may be longer, some patients it may be shorter. There's lots of changes in the transplant world. The ability to treat hepatitis C changed a lot of things, because a lot more kidneys were able to be accepted if recipients said, I would accept a hepatitis C kidney, and then they would get the kidney and then undergo 6 months of treatment for hepatitis C and be cured. So and it also varies on your blood type. It varies on how many antibodies you have in your blood. So it gets kind of complicated, but I guess I would still say a ballpark 5-ish years, with a lot of variation depending on your individual factors. All right, so COVID-19 and kidney failure. So people with kidney disease are at higher risk for developing severe COVID-19 infection. People on dialysis and kidney transplant patients have the highest risk. And that is because being on dialysis and having a kidney transplant means you are immune suppressed, which means your immune system doesn't work as well as someone who's not on dialysis or doesn't have a kidney transplant. So you can't respond the same way to infection that someone else can. In addition, severe COVID-19 infection can hurt the kidneys. So someone with no kidney problems before gets severe COVID-19. One of the problems we've seen, you hear mostly about the lungs and the needing a ventilator, but we've seen acute kidney injury in about 15% of our hospitalized COVID-19 patients. And most people who develop that acute kidney injury will recover if they have access to the proper treatment, but it can lead to an increased risk for developing chronic kidney disease later. So if you are, say, you're someone with, say, diabetes, and you get COVID-19, no kidney problems yet, you get diabetes, and you end up with an acute kidney injury, and you are lucky enough to recover, you will be now at even higher risk of developing chronic kidney disease later in your life. Organ donation and transplant. So nearly 100,000 people are waiting for a kidney transplant in the US. That is a lot of people. In 2019, almost 4,000 people died waiting for a kidney. So that's people, like you just mentioned, that waiting time on the transplant list. People didn't get a kidney. And they would have lived longer had they received a kidney in that year. In 2019, we transplanted around 23,000 people, but in that year, over 40,000 were added to the wait list. So we're not catching up. In fact, we're getting behind. So and transplant, we know, is the optimal, the best treatment for kidney failure. Dialysis is certainly an option and something that's important to many, many people. But for lots of people, a transplant is ideal. It leads to a better lifestyle, less risk of other complications, and longer life.
Dr. Chang, I have a question real quick. As far as the transplant, at what point should a person start thinking about a transplant? I know sometimes when you think about transplant, you're thinking by the time your kidney is about to shut down, it's pretty much shot. But what is the time frame that they should be starting to look at transplants?
So hopefully they have a kidney doctor by then. And if their kidney doctor is worth their salt, maybe not salt because they should be a low salt diet. But if what they should be doing is referring the patient as soon as they're eligible. And that the current eligibility is when you're at about 20% function, or it's clear you're headed that way. And the reason for that is that wait list time that you were asked about, because the sooner we can get you on a wait list, the better. Because let's say you're at 20% function. I told you, you still don't really have symptoms. You can live a mostly normal life. You have to check in with your kidney doctor. You have some dietary restrictions. You have some medicines you have to take, but you're functioning, normally. Well, if we can get you on the wait list when you're at 20% and you have a slow decline over the next 6 years, 7 years, 8 years, but come 8 or 10 years later, you need a kidney because it's gotten worse. Well, at that point, you're probably at the top of the list and are eligible to get a kidney. And guess what? You did not need dialysis. And that's a huge plus, not just because it's so great to not need dialysis. It actually, we have shown that you have better outcomes if you never need dialysis. If you go straight from kidney failure to transplant, that's the best possible outcome if you're going to have kidney failure. So 20 is the magic number. And certain centers are being more lenient now. If it's clear you're headed towards 20, they'll go ahead and start the process. And it takes, for someone who's very diligent, has good about responding, answering the phones, getting to their appointments and all that. I think the fastest I've seen someone get through it is just under 6 months. So it takes time. There's a lot of hurdles. There's a lot of things that have to be done. And for each patient, what has to be done is different. And for some patients, there may need to be more tests than others. So it takes time to get through it. So the sooner you can get started, the better. And then
can you talk a little bit more about multilisting?
At different centers, you mean?
Mm-hmm.
Yeah, so you can also, for proactive patients, this is a great thing too. You get listed at one center, you can go get listed somewhere else. It has to be in a different, I forgot what they call it, but different areas. There are certain hospitals that are in the same area. For instance, we're the same as Duke. We have the same, when the organ transplant send out a call, like we have an organ, we cover the same catchment area. But if you go outside the catchment area and there are other centers, you can get listed at both of them. And some centers have shorter time. So if you're listed at multiple centers, it's definitely an advantage because you'll take the first one that's available. And you may have to travel if you have listed somewhere a little farther away, but it's worth it to get a kidney if you can get there. And then after you get your initial care from them, you can transfer. It's usually, they like to see patients for the first year after their transplant to make sure they're taking care of them. And then you can transfer back to whatever your home site is, what's closest to you. But definitely an advantage and something to ask about and look into about whether that would be helpful for you. Anything else, Katey?
This question actually came up in a previous Your Kidneys and You I did, but Are there ever patients that can't go on dialysis? I know that there are accesses and things like that, but when those break down, if there are patients who can't go on dialysis, what are their options?
Oh, that's a hard one. So, so we have so many different options now, like through the belly. You can do hemodialysis through a catheter and through a surgically created access in your arm or your leg. That's not a common situation, but it does happen. And we do everything we can to try and be preventive about that. And that's why we ask patients who have chronic kidney disease to save patients who have kidney failure to save their arms in terms of not doing certain things on their arm that we need to put an access in. So we'll have certain save arm precautions to prevent not being able to use their arm for access. So there are very extreme circumstances where we have done dialysis through catheters in the liver, through the spine. Those are very end stage and very rare. I think I've seen one of each during my time, and I've been a fellow. So my total time in nephrology has been 11 years now, and I've seen one of each of those. And I can't remember, Katey, do we ever talk about medical management without dialysis? Because that's an option too.
I don't think it's mentioned in this PowerPoint now.
Yeah, so can I mention it briefly here?
Of course.
Thanks. And I have a specific interest in this area because one of the things that we have been realizing is that we need to give more patients more choices. And some patients may not want to do dialysis, and they may accept the risks that come with not doing dialysis. And in these cases, we don't just stop treating you. We treat you with medicines so that you don't feel terrible, understanding that your kidneys are getting worse and you'll likely die sooner because that's what happens with kidney failure. But we help you feel better so that you're not feeling like the things like the itching, appetite. We do things medically to treat the symptoms without fixing or doing the dialysis to take over the job of the kidneys. And that's definitely becoming an option that we are understanding more and trying to help our patients navigate, because some patients really do want that. And we're never presented that option because we as the kidney doctors didn't really know how to present that option or how to help patients with that. So that's another option too. Okay, so there are some groups at greater risk of kidney disease and kidney failure, and we have listed them here, some here. African Americans are about 3 times more likely to develop kidney failure. Hispanic and Latino Americans, about 1.5 times more likely. American Indians, Asians, and Pacific Islanders also at higher risk. So it's a common theme. You probably seen and heard that with other diseases, and it's the same, similar for the kidneys, higher risk for these groups.
Dr. Chang, is there any research on why these specific groups are the highest?
Yes, and there's some answers, but not all answers. So I mentioned before some genetic stuff, and there are some, there is a gene APOL1 that is predominant in African Americans. And sometimes when you see clusters in families, we have a high suspicion that APOL1 runs in that family. But I think also we're now realizing there's certain socioeconomic, wait, that's not the word I'm looking for. There are factors related to access to right foods, access to care, access to information in these populations that don't necessarily have to do with race per se as a physiological or a medical thing, but more as the environment surrounding us.
So with those who are, in areas in North Carolina, we have places called food deserts where you don't have, access to really good food, but I can go to the gas station and get, fried chicken or what so have you, easily. So would that be one of the contributing factors to that? Okay.
Absolutely, 100%. That is a big issue. And there are a lot of groups research in that area, groups looking into that. How do we address these food desert issues? Because that's, in my mind, that's huge. I definitely have patients when I talk to them about diet, they're like, well, I go to the Dollar General to get most of my foods. And it's at the Dollar General.
Yeah.
And I think doing things like the infrastructure work to bring internet to a lot more people has the potential to help. If we bring internet to more people with delivery things, that can help for people who can't travel to somewhere to get something. We can have, they have options for delivery, but you have to have internet to order those things. You have to have savvy, you have to have a computer to do that. So there's always, there's barriers everywhere you look. So there's work to be done in just about every area to break down these barriers and make a healthier environment for our patients. And it's unfortunately impacts these groups you see here in a way more than your mainstream groups.
Have y'all done research on your reservations?
Native American reservations?
Yes, ma'am.
Yeah, I think there is research. I don't know specific, but yeah. And Native Americans are at increased risk of kidney diseases as well, for a lot of similar, but other different reasons too.
Okay.
Okay, so the economic impact of kidney disease. So kidney disease represents over 30% of Medicare fee for spending. So it's just incredible how much money goes into taking care of kidney patients. If you look here, $36 billion to end-stage kidney disease, $84 billion to chronic kidney disease. What we have to do is preventative medicine, prevent patients from getting to end stage so it's not sucking up all those dollars. Prevent CKD, people from getting to CKD and those at risk. So all of that requires diagnosing things early, because the earlier we know about it, the earlier we can alert you to it, the earlier we can work with patients to find ways to adjust their diet, find ways, get them on medicines that will help prevent it, treat those underlying conditions like the diabetes, heart disease, high blood pressure, and even prevent those, because a lot of those are caused by things in the environment, by our diet, by our lack of exercise. And if we can prevent the underlying causes, the underlying risk factors, we will reduce our risk of development of CKD. So put me out of a job. That's what we want to do. We're working to put kidney doctors out of a job, but we'll find something else to do.
Dr. Chang, speaking about, I guess, the fees, is there anything nationally or statewide going to the House to find ways to either help with medical insurance, especially Medicaid and Medicare, to help cover the costs for dialysis patients, kidney disease patients?
So a couple of years ago, there was an initiative signed. What was it called, Katey? The Advancing
Kidney Health. And that was, so at the time, President Trump had signed that into law. And what it was saying is that by, Emily, correct me if I'm wrong, I think it was 2025, that they were going to start diagnosing more people at around 80% to try and reduce the 90% of kidney patients who don't know that they have kidney disease. So that initiative is really geared towards preventative care. And NKF, along with our counterparts in the nonprofit world, but also our hospital systems, we go once a year and lobby nationally in DC to help see these changes made. Here locally, which I'll talk about a little bit later, we're focusing very, very heavily on our Living Donation Protection Act here locally. I'm not sure if you're aware, but Representative Shepard out of Onslow County, he is actually a kidney donor recipient, and he received a kidney several years ago, and he's kind of spearheading this effort to promote living donation and to help living donors, after they've donated a kidney, because a lot of times they are not able to receive the same amount of life insurance that they received before they gave a kidney. So they're being barred. We're seeing some barriers there. So we're trying to help with that. And with living donation, as Emily mentioned earlier, that 5 to 7 year wait, if you find a living donor, that will significantly reduce your rate of waiting. Did that answer your question, Christina? I know I said a lot there.
No, because it was, I'm looking at, because I know here in the state of North Carolina, Medicaid, especially for single persons without children, you really can't get any coverage. So that's why I was asking, has anything gone to the state level to even help those persons that need the medical care leading up to the end stage, God forbid, of kidney disease?
Yes, like I said, locally, we're focused on the Living Donor Protection Act, and hopefully we'll be able to bring more of that once we kind of get this set in place. But I know nationally we are working on more help for kidney patients to help them with Medicare and Medicaid and everything. But I was planning on sending you a follow-up email after this with a bunch of resources to send out to everybody, but I'll make sure to include links and things to all of those in case anyone's interested in learning more about them.
Thank you.
And I do think that I'm just frustrated. I'm probably not, but I'm frustrated with North Carolina and the lack of expansion of Medicaid, because that would help so many of our patients. I mean, a lot of our kidney disease patients. So if anyone knows anyone in the legislature, like, we need to figure out how to pass this, get that passed. I feel like that would do more than anything else right now to impact kidney health in North Carolina. Okay. All right, so this kind of summarizes what we've been talking about. What can you do? You can get tested. Even if you have just one of the risk factors we mentioned, get tested. Visit that website, minuteforyourkidneys.com, and to check on your risk. Control your risk. If you have any of the risk factors, keep your blood sugar, your blood pressure under control in order to prevent kidney damage. Eat healthy, drink water. Oh, I forgot to mention drink water when you asked about diet before. And watch the salt. So, and in general, the general healthy diet you hear about for your heart, for everything else, is good for your kidneys. So fruits, lots of fruits and vegetables, keeping the salt low, and not too many fried and fatty foods. There's something called a DASH diet, DASH, and it helps. It's a low salt diet. Mediterranean diet is always a really good one. Use of olive oil, it just has been shown to have a lot of health benefits. Get moving. Physical activity has many health benefits, and by moving, it's as simple as walking. Walking is great. Helps to control your weight, blood pressure, blood sugar, and gets the blood flow going, and all kinds of benefits of walking. And more activity if you can do more than walking. Quit smoking, referring to the question from Margie earlier. It's not easy, but it's important. Smoking does impact your risk of kidney disease. And then medicines that I had mentioned earlier, pain medicines, particularly ibuprofen, Aleve, naproxen, ibuprofen, Advil, naproxen, and Aleve.
They're so easy to get and people eat them like candy sometimes. Be careful, especially if you have one of the risk factors.
Emily, since, aspirin, ibuprofen, and naproxen, Aleve, Advil, since those can cause kidney damage, what are some of those over-the-counter pain medications, if any, that people can take that may not be as harmful to the
Tylenol. Tylenol is not harmful to your kidneys. Tylenol. So that's Tylenol, and the generic for that is acetaminophen. That's the safest. As far as healthy eating, fill at least half your plate with fruits and vegetables. They're so good for so many reasons, not just your kidneys. Aim for half your grains as whole grains. Move to low fat or fat-free dairy sources. And you can kind of do that in a step down fashion. If you were using whole milk, you can move gradually to 2%, 1%, just like there's levels now. Vary your types of protein, not just red meat. You can use poultry, non-meat proteins. Drink about 8 to 10 glasses of water per day. If you have a question of how much, ask your doctor what's good for you. But our general rule is if you're thirsty, drink. Just make sure to listen to your body. Your body will tell you when you need to drink water. Take note of portion sizes. Don't eat beyond when you're full. Save it for later. Limit saturated fat, sodium, and added sugar. As far as physical activity, aim for at least 150 minutes each week of physical activity, a moderate to vigorous level. Even if you're at nothing, you don't need to go to that right away. I tell my patients it's a ramp up thing. A little is better than none, and work your way into it. If you try to jump into it, be like, I got myself a new treadmill and I'm going to go an hour every day, you're going to poop out by day 3 and you're going to quit and you're going to get hurt and you're going to not want to do it ever again. So start with 10 minutes, work up to 15 minutes a day, then 20 minutes, and you'll be there. 20 minutes a day, 7 days a week, that gets you just about 150 minutes. Make sure to do at least 10 minutes at a time for the added health benefits. And then think about what are ways to add movement to your day. And I actually do that just in a, like, and this is a little excessive, even my colleagues think I'm crazy, but we work on the 7th floor. And now that I had some ankle surgeries, hip surgery, now that they're all better, I walk those steps to the 7th floor every day. If you didn't want to do that, walk 3 of them and then take the elevator to the last floor. Park a little further away so you make yourself walk. If you have one of those sedentary jobs where you're at the computer all day, drink a lot of water so you have to get up and go to the bathroom periodically. Or if you're working from home because of all this COVID, make yourself get up and take a walk around the house or take a walk around your block, every so often. Little tricks. Okay, now I'm ready to move on. Is this me or you?
I'll take this one over. So as Emily mentioned, there are a ton of different ways and changes that you can make, but we know that they're not necessarily easy changes to make in your life. So we have a couple of resources here that might be helpful to you. The first one is the National Diabetes Prevention Program. And this program is focused on healthy eating and physical activity to prevent diabetes. And this program across the country has helped cut the risk of developing type 2 diabetes of participants by 58%. It focuses on lifelong changes to certain habits and behaviors and helps participants maintain improvement and improve over time. This program is offered across the country and in many cases is covered by insurance or is offered for a very low cost. There's also the Chronic Disease Self-Management Program. And this is designed to help people with chronic conditions such as diabetes, hypertension, or high blood pressure and arthritis. These are small group classes of about 8 to 15 people, and they're led by peer instructors. Again, they focus on topics such as communicating with healthcare providers, managing medications, healthy eating and nutrition, and physical activity. And these programs have shown many benefits, such as reducing hospitalization and improving participant quality of life. And then the program is also available community-wide, and is usually offered for a low cost. And the next one is the Diabetes Self-Management Education and Support Program. And this program is tailored to your individual needs. And it's guided, you'll learn how to eat and be physically active. You'll learn how to monitor your blood sugar levels, how to take medications properly, problem solve, reduce risks for other health conditions, and cope with the emotional side of being diagnosed with diabetes. These programs are normally led by a diabetes educator, a physician, a dietitian, or a pharmacist. And you should sign up for these services when you first get diagnosed with diabetes, or if there's like a significant health change. And these programs are offered across the country. They're normally covered by private insurance, Medicare, or Medicaid, and they can be offered in person, online, or by phone. And then finally, the smoking cessation resources, the 1-800-QUIT-NOW number. The people who are in charge of this resource, a lot of them are former smokers, so they have been in your shoes and they're willing to help you quit. This is available throughout the country in multiple languages. And they just have trained coaches who are able to help guide you through this process and provide additional resources. So again, I wanted to mention the Are You the 33% or the Minute for Your Kidneys risk quiz. I can't tell you how important this quiz is. It takes all of a minute. And as Emily mentioned earlier, you'll get information just on your specific risk factors that you can take to your doctor to talk about. And also, I'm not sure if we mentioned this, Emily, or not, but with both the urine test and the GFR test, your primary care physician should be running those tests for you at your yearly physical. If they're not, please make sure that they do. And those tests are normally covered by your insurance. Okay, so just a little bit about the National Kidney Foundation. We're here to help you guys. This is what I am here for, these presentations, but also to help you understand some of the resources that we have. So the first one that we have is our NKF Cares hotline. This hotline, we have trained professionals who are able to answer all of your kidney questions. So if you have specific questions about kidney disease and diabetes, or kidney disease and hypertension, or hyperkalemia, or any kind of topic that pops up, whether it's trying to find help to pay bills or finding transportation, these professionals can help you identify your needs and help you find resources. Our NKF Peers hotline, and both of these hotlines are free to call. Our NKF Peers hotline, this is a mentoring program that we have. So if you're someone who's just been diagnosed with kidney disease, is going through the transplant process, has just had a transplant, or if you're interested in becoming a living donor, we can partner you up with someone to just kind of talk through those feelings, and that way you have someone who's been in your shoes and can help you along through that process. And then finally, we have our online communities. This is a great way to just find support. We have different communities. We have one for physicians, we have one for patients, caregivers, and I believe there's also one for pediatrics as well. And you can find any and every question on there. And I've gone through and I've looked at several of the different questions and comments, and the group is just so supportive. So if you have any questions or if you're concerned, please feel free to connect with everyone online there. It's a really great community to be in touch with. So we mentioned the urine test, or the albumin to creatinine ACR test. Pre-COVID, we hosted Keep Healthy screenings, which we would do at health fairs, or we would go out to businesses and host them. And what we would do is we would check your blood pressure, we'd check your height, weight, BMI, and then we'd ask you to give us a urine sample. We would then run a test. You'd get your test results back in about 50 seconds, and we would have a nephrologist or a physician on site to just talk through your results with you. You'd also get a copy to be able to take to your primary care physician. That way, any questions you had, they could help you and start monitoring if your test results came back as abnormal, or that you had protein in your urine. We also focus on public awareness campaigns. Again, the 33% in the minute for your a minute for your kidneys risk quiz. And I saw a question come through. Oh, it's okay, Emily. So there's an analogy that we like to use if you want to talk about it real fast, Emily, with your kidneys and filtering everything out.
I totally forgot to mention it when I was giving the presentation. I'm so sorry. But when I was talking about how the kidney does the cleaning, a really good way to think about it is to compare how the kidneys work to a coffee filter. So when you make the coffee, the filter keeps the coffee grains inside, but allows the water to go through. If you remember back when we used to use coffee pots, well, your kidneys do something similar. They keep what you need inside the body and out the things that you don't need. So the coffee in your coffee pot is like the clean blood sent back into your body. The grounds are the waste products, and you get rid of those. So it's sort of a helpful way to think of what all those little filtering units are doing. Sorry.
No problem. Thank you so much. Also, we provide some programs and resources for healthcare professionals. We keep them up to date on the most effective treatments through in-person conferences and online activities. And then we also have our CKD Intercept initiative, which aims to improve early detection and treatment in the primary care setting. So this is just more education to primary care physicians to help identify kidney disease at earlier times. That way, patients aren't either crashing into dialysis or they aren't diagnosed at the later stages, and we can do something to try and slow or stop the progression of kidney disease. And then finally, we're here to build a community. So we do host several programmatic events, but we also have our North Carolina Kidney Walk, which is happening on November 14th. If anyone's interested, I have the web link there. But I also wanted to let you guys know about a transplant webinar that we have coming up, because I know that there were a lot of questions on transplant. So this workshop is part of our Big Ask, Big Give initiative or campaign that we have at the National Kidney Foundation, which just focuses on transplant and living donation. The First Steps to Transplant webinar is really just a transplant 101, how you get listed on the transplant waiting list, the different type of transplants, and who you would need to contact. So it kind of goes over everything in that webinar. And we'll also have a panelist of a living kidney donor and also a transplant recipient on there to just kind of talk about their experiences. So that's going to be on September 23rd. And the link is right here. It's kidney.org/BABG-NC-September. But I will send that out to Christina to send to you guys. That way you have it if you're interested in registering for that event. And then finally, please share what you learned with others today. You know, as we mentioned at the beginning of the webinar, there aren't a lot of signs or symptoms of kidney disease until you're in the later stages. 90% of people don't know that they have kidney disease, and there's 1 in 3 people, you know, who are at risk. So just, you know, make sure to share this with everyone that you can think of. It is extremely important, especially since we can slow or stop the progression if caught early. And then lastly, I wanted to let you guys know about kidney.org/take-action. This is our advocacy website where you can go and you can take a look at all the initiatives that we are trying to achieve throughout the country. And as I mentioned earlier, we're focusing on the Living Donor Protection Act, but I will also send this link out to Christina so she can make sure everyone gets it. And that is all that we have for you guys today. Are there any questions, concerns? I hope we didn't scare you too much.
No, it was a great, I'm lost for words, great presentation, lots and lots and lots of information, definitely to take in. The floor is open to anyone. Please, if you have any questions, you can ask away right now.
I will say one question that I get quite a bit, and it is in regards to COVID and to vaccines and everything. Emily, are you because you're practicing, so in center, in the hospitals and everything, are you seeing a lot of your patients with COVID now, or with the vaccine? Has it really helped, kind of reduce the number of patients you're seeing with COVID? How is that? What are you seeing?
You're asking me, have I seen where the vaccine has helped reduce the numbers of our dialysis and kidney patients? The problem is that not all my patients are getting vaccinated. And I sort of see them some in clinic, and then we see some in the hospital, some in dialysis. So it hasn't, and I'm a little bit of everything. So it's hard for me to say, because I don't have a big enough sample size of one thing to say. But I will say, and also, yeah.
Sorry, I didn't mean to put you on the spot.
Well, I'm just thinking through it. I'm in so many different areas that it's not like I'm in the hospital all the time. So I don't know that I have the answer to that question for you. And also, not all my patients are vaccinated, which is a struggle, something I keep working on, but not everyone is.
Another question that I get a lot of questions on are kidney stones and kidney disease. If you have frequent kidney stones, can that lead to chronic kidney disease?
Yes, it can. Usually really bad ones, or if you have a lot frequently, can lead, are the ones that I see. And usually I only see them if they've led to kidney disease. I also wonder too, because one of the risk factors for kidney stones is not drinking enough water, and that can also cause you to have some kidney disease too. So sort of a similar risk factor of being chronically dehydrated leads to both. But definitely kidney stones related to kidney disease. And these days, if you have stones, they're actually really good clinics in most places where you see it's stone clinic, and you see a kidney doctor, a specialist like me, which is a medical kidney doctor, but also the surgical kidney doctor, because this is one area where we have to work together to take care of those patients. But kidney stones definitely risk for kidney disease.
Okay. Are there any other questions from the audience?
I have one question. I know some relatives and friends stated that they are not able to get vaccinated because of some underlying issues that they may have that's causing them not to be able to get vaccinated. My question is, if I was diagnosed with kidney disease, is that one of those underlying issues that will cause me from getting the vaccine?
No, that's actually an underlying issue that would make it more imperative for you to get the vaccine, because you're at someone with kidney disease has higher risk of problems with COVID if they get it. And there's no contraindication or reason that kidney disease keeps you from getting it. So in fact, it's kind of the opposite. It should be even more urgent to get the vaccine then.
And what are the stats, women versus men, that are more likely to have kidney disease, and why?
Oh, I feel like I knew that once and I can't remember. Do you know, Katey?
I don't have the stats on who's more likely to get it, but I do know, because of a study that I read, that once you have been diagnosed with kidney disease, that it was showing that men actually seem to take better care of themselves once they've been diagnosed. But a lot of that has to do with because their caregiver, their wife, their partner, whoever it is forcing them, or not forcing them, is making sure that they're taking care of themselves the way that they need to be. So the progression slows or stops a little bit. And women seem to have to progress further because they're normally the caregivers and the ones telling people what to do. But as women, we tend not to focus so much on ourselves. So that's something that I've seen just in studies, if that's helpful at all.
I have definitely have a couple of patients I can think of off the top of my head that got into problems with kidneys because they were so busy taking care of others in their life that they neglected themselves. So, and they're all women that has, I can think of 3 off the top of my head.
And my last question, and I apologize, I'm a biology major, so I ask these questions. I wanted to know, we don't put much emphasis on this topic, which is genetic counseling, which was, of course, one of my favorite subjects to study. But genetic counseling, I think, is very important for us to possibly get that at one point. So we know, I think you said this could possibly be genetic, but is it important for us to have that genetic counseling to learn what possibly could be going on in the genes, what we get from our ancestors, so on and so on?
Yeah, I think that the genetic stuff is so interesting and so tricky. It's tricky because, so I mentioned this ApoL1, and it can be useful, but there are also potential downsides to coming with a diagnosis, because if you get labeled with something that can impact your insurance rates, those kind of things, someone's willingness to insure you. And I think it does come up in the transplant world a lot. And I am not a transplant nephrologist, but I know that we have talked about it in some meetings about whether it's worth it to get that genetic testing to see, do you carry ApoL1? Will that exclude you from being a donor? But not everyone with ApoL1 gets kidney disease. So we don't necessarily want to exclude people. So I think definitely, and we have genetics counselors that are trained in issues like these that are really important. And I think the more we learn from it, the more this is going to come up, things like that. And there are also other kidney disease that are very genetic related, like such as polycystic kidney disease. That's definitely one, a disease called Fabry's, which is pretty rare, but it's also genetic. So there are several, quite a number of genetic diseases that it can be important and helpful to know what you have and who in your family may have it. But it's always, I think, important to navigate that with a genetic counselor, so you think carefully through it before doing things.
Okay, are there any other questions at this time? Okay, so once again, I wish to thank our presenters, Ms. Cipriani and Dr. Chang, for this extensive presentation about the kidneys and other factors that can cause the issues. What I'm going to do at this time is give the floor to some of our members. I see that we do have the president of the derm section. Is Ms. Cooper still in here? I guess not.
Hi, I'm the president of the derm section. My name is Sandra Crops.
Okay.
And I thought for a moment I didn't really need to come to this presentation, but I'm glad I did, because I've got quite a few of those risk factors. And so this has been very informative, and thank you very much for making it available to us.
Of course. Thank you so much for having us. We love doing stuff like this, and that's what we're here for. What I'm here for is to be a resource for all of you. So please, if you have any questions, please just let me know. And I have no problem bothering all of my medical advisory board members to get questions answered for you guys.
Okay, I also see another member from the Fayetteville section. If you would like to introduce yourself. You're on mute. Okay.
Well, good evening, everyone.
Sorry.
Oh, I'm sorry.
Excuse me. Excuse me.
Yes, yes.
Okay. Very, very interesting. Sorry, I missed some of it. I went to the Evite and it closed me out. Went back online for something else and I saw where Margie had sent me a link. So I was able to get on that way, and I'm very glad I did because I'm in that age group where so many of my friends and associates are on dialysis. And so I've learned vicariously about this just through association. I knew a little, but this was very interesting, and I'm very happy that it's being recorded because I want to go back and listen. I'm president of the Fayetteville area section of the National Council of Negro Women, but I also serve as state president. And we've been promoting this around the state, but it's summertime and it's hard to get traction. But I do see that 2 of the other Fayetteville members have joined, so they may want to say something. But prior to that, let me say that we really appreciate Margie and her team and Christina and Sister Turner for taking on this initiative. We're engaged in a national endeavor, and you may see the slide that says GHW wins, good health wins, and we're dealing with all of it. And Margie is just marched right along ahead of us and set the pace, so we have to follow through now. But do want to say we do have a leader here in this area of health, as well as in women issues in Margie. So again, want to congratulate her and her committee for this undertaking. Thank you.
Thank you again, Madam State President, for those kind words. And once again, our Alamance-Guilford section president, would you have any last departing words for us?
Once again, I would like to say thank you to our speakers for coming. I really appreciate it. It was very informative. I actually had an aunt who had kidney failure as well as breast cancer as well. And I watched her to her dying day dealing with both and going to dialysis. And so it was kind of hard to watch. So I appreciate that. Also, I would like to say that I'd like to thank again our team who put this together, Christina Austin and Jovan Turner. I would like to thank members of the Fayetteville area section, along with our state president, Ms. Queen DeGraffery, and the Durham section president, Ms. Kropp, for coming. We do have a couple of other days that are coming. Let's get through that real quick so you can see what we have going on. But before we go, I would like to say that with our Good Health Win, we have NCNW, National Council of Negro Women, have partnered with Uber, and they are giving free rides up to $25 for your going to get your vaccine. For your vaccine appointment, it's 4 free rides up to $25 per person. It ends September 30th. And I'm sorry, I got a baby in the background. And these are the states that they're actually partnering in. So, and this is the step. So please share this, that we do have this Uber going. Also, Just to let you know, we have 2 more nights. Tomorrow night, we will have Miss Webb and Miss Alford. Miss Webb will come on and talk about facts and myths for college students. And also Miss Alford will come on with a workout session. So please come out and work out with us. She'll be doing some things for our seniors and then also for our younger people as well. On Friday, we were in with a motivational speaker. What kind of life is this with Dr. Rice? He is the host of the WNAA 90.1, The First Light. And so we look forward to having you. It's the same link, same time, same back station. We will be here. These are the topics that we will have. I would also like to say that we are actually planning a vaccination clinic. So that will be coming soon, hopefully in October. We'll be partnering with the Guilford County Health Department. They will set up a vaccination clinic for us. You can come and get your vaccine. Also, they will be offering the booster as well. So please look forward to more information on that. So again, I thank you for coming. I'm gonna turn it back over to Ms. Christina Austin.
Okay, once again, thank you so much, everyone, for coming out. If there are no other questions for our presenters, once again, thank you. Yes.
Ms. Christina, I did want to acknowledge that 2 other Fayetteville area section members had joined us. Ms. Sandra Cooper and Mary Highsmith did join us tonight. So I did want you to know we have a little more support from down east. Yeah.
Thank you, Madam President, for everyone, especially the Fayetteville and Durham sections. Thank you for joining us, and hopefully we will see everyone tomorrow and Friday. And to our presenters, if you wish to also come on through our links for tomorrow and Friday, you are more than welcome. If there's nothing else, we would like to end this session this evening, and any emails or any other information I will forward out to the rest of the state. If there's any other questions, please feel free to email to Alamance-Guilford NCNW at gmail.com. Sorry. If there are any other additional questions that you may have had or forgot to ask and want to have answers to. So if there's nothing else, everyone have a good and blessed evening.
Thank you so much. Bye.
Yeah. Bye-bye.